demonstration here is to show you how you can provide an anterior temporary crown shell utilizing the direct crown polycarbonate clear anterior crown forms. In this particular case, we're looking at tooth number 8, and the patient has already been prepared, numbed and prepared. We're utilizing a model to be able to show this technique. We will try on a temporary crown form to see how it fits. Has the proper widths interproximally. It appears to cover down to the gingiva quite well. You would examine it through a mirror, see that it clears the lingual aspect. So we'll be able to utilize this particular crown shell form, which is to be used on the anterior tooth number 8 here. This particular shell form is the XL shell form. At this point, you'll have to make a decision which way you want to line this crown shell form, whether you're going to be using an acrylic technique or if you're going to be using a bisacryl technique. In the acrylic technique, you're going to take the properly sized and shaped crown shell, polycarbonate crown shell form, and we'll take and place a liner of acrylic. In this technique, you're going to take a small amount of monomer, the liquid, because this is a powder liquid acrylic. You'll take the liquid, add it into the dappen dish, and get that cover on. Go ahead and get the powder to go into, incorporated into the liquid. I will warn you, this is a very fast setting material. It is a fast setting acrylic, so I'm going to get most of the incorporation there from the powder going directly into the liquid. And now I'm going to take and wait till it gets just a slight little rubbery stage, and we're going to add that to the inside of the crown shell. We're going to take that and go directly to the mouth and place the crown shell till we get it fully seated. You'll see the excess comes flowing out around the edges. We're going to be testing that material back in the dappen dish, out in the mouth. You'll see that it's already starting to get a rubbery stage to it. At that point, we're going to want to take and make sure that it's able to get removed from the tooth structure so that it doesn't lock into the undercuts. And we'll take that on and off a few times, and on and off a few times. And it's starting to get rubbery on the outside edge, so you'll see that I'm getting a little dried material there. And once we get the final hardening of the material, because it's at 2 minutes and 45 seconds, and I'm telling you this is getting very firm already. Okay, now we'll remove the acrylic lined polycarbonate crown shell and take it to the lab and trim that and then return back to the patient. Once your assistant has trimmed and polished the final temporary restoration, you'd bring it back to the patient's mouth, test it, make sure of marginal integrity, make sure that the floss is holding the adjacent teeth where it needs to be to maintain the interproximal positions of those teeth, and you would cement it to place utilizing a good temporary cement that you would utilize for any of the other provisional or temporary restorations that are there.